privileged to introduce you to some information about the impact and control of bovine reproductive pathogens. As we're here talking mostly about bovine viral diarrhea virus, it's important for us to understand the many causes that can result in reproductive loss. Most producers are not in a situation where they go out and actively are looking to identify these situations of loss, but in essence simply going out and finding the problems. The most dramatic of the problems that are seen happen to occur when there's a loss of a fetus in late gestation. It tends to be really dramatic, it tends to be really significant for a producer to find these losses, and that often leads them to contact their veterinarian to investigate what was the cause of this reproductive loss. We need to understand there are non-infectious causes of reproductive loss and there are infectious causes. When we start talking about the infectious causes, we can see the bacteria, the virus, the protozoal agents all play a role in this process. It's important for us to understand, if we look at a hallmark study published by Kirkbride in 1992, it's important for you as a veterinarian working with a producer to be very straightforward in the fact that when an aborted bovine fetus is identified and all appropriate samples are submitted to the diagnostic lab, the chance of identifying that causative agent as an infectious agent is less than 50%. You can see by the chart on your screen that we're going to have 26% of these aborted bovine fetuses that don't identify any lesions or any cause of lesions. We're going to have another 26% that show lesions present, but no identifying agent can be seen in those fetuses. So interestingly, you can argue that, well, this was back in 1992 and we've come a long way since 1992. You will see that Wilson just recently published an article in 2016. So we have many new diagnostic tests in this situation. In this 2016 manuscript that was recently published out of Canada, we see almost the same percentage of aborted bovine fetuses that result in either no diagnosis, or even if they identify lesions, they cannot identify an infectious cause of these bovine abortions. I say all this to say, as veterinarians working with producers, we need to understand when we identify a calf that is born before term, this aborted fetus, there can be many infectious causes and some non-infectious causes of that loss. And in working with those producers, we need to be clear that the diagnostic tests are going to rule out many things, and we need to be satisfied in accurate testing to say what can we identify, all the while understanding that in a majority of cases, no infectious cause will be identified causing that bovine abortion. We also need to understand that when you have a producer who's looking at these late-term abortions, while they are tremendously dramatic and tremendously concerning, that's really only the tip of the iceberg, because anytime there's an infectious cause for bovine abortion, there's often this reproductive loss associated with infertility, associated with early embryonic death, where we're going to see other issues that are actually causing more significant problems, even though those problems are less dramatic. So you see in this slide that the incidence of early loss, infertility, early embryonic loss, is greater than the loss that we see in and around this time of parturition, which is actually greater than the loss that we see in the early stages of this calf's life. So we can use this situation to help the producer to think about early causes of reproductive loss that actually may be more significant for their operation. So as we talk about the different causes of bovine reproductive loss, we can list out a large number of bacteria, fungi, protozoal, and viral agents. Understand as we consider this, it simply helps us to go in with a full list of potential diagnoses as we consider this issue. It's also important to communicate to producers early on that some of these agents are zoonotic, meaning that they will cause infection and disease in people. So as we talk about brucella, as we talk about lepto, as we talk about Q fever, as we talk about chlamydiophila or Toxoplasma gondii, we need to have a clear understanding that in those situations we're not only concerned about cattle health and well-being, we also have to be concerned about human health and well-being. So for today's discussion, we're going to focus on 8 pathogens. These 8 pathogens often cause reproductive loss, in different areas of the world, and they help to give us a full picture of the different types of agents that we need to be concerned about. The first agent that we'll talk about is Campylobacter fetus subspecies venerealis. This is a situation where we have a bacterial organism. It's a gram-negative, motile, S-shaped bacteria. It usually causes infertility. It will cause some late abortions, but we have to really be more concerned about the infertility, about the delayed conception that we see in cows because of this bacterial organism. This disease in many parts of the world is called vibriosis. It is a venereally transmitted bacterial agent that can cause significant reproductive loss because of the infertility. This is one of the two venereally transmitted agents that we'll talk about as we consider the different reproductive pathogens of concern. This organism can survive in the cervix of the female through a full gestation, so we do have to have some control measures in place. Diagnosis is by culture of the organism from the appropriate sample. From the bull, that's preputial smegma semen. From the female, it can be fetal fluid, placental, or vaginal discharge. Culling of animals. This is a List B disease for the Office of International Epizootics, the World Animal Health Organization. Testing is required before cryopreservation of semen, and antibiotics are added to bovine semen prior to cryopreservation to ensure that this organism is not accidentally transmitted and associated with samples that have already been tested negative in this system. Vaccines can be used to mitigate problems. Vaccines are associated with prevention of both infection and also apparent cure, indicating to us that the vaccines available for Campylobacter fetus subspecies venerealis are certainly very effective. There are some documented situations in the literature where the organism has not been controlled by vaccination. In these cases, it appears that the field strains have mutations such that the vaccine does not allow appropriate or effective vaccination. So there is some concern because of those reports in the literature. As we shift to another organism, this organism is really indicative to us of a whole set of bacterial organisms. This agent called Histophila somni, it's associated with some respiratory disease in calves, but also can be associated with reproductive loss. The challenge here with this small motile gram-negative rod is the question of whether or not the organism, if identified, is it a common bacterial normal flora? So is it just simply there because it's there, or is it actually causing disease? So in the diagnostic laboratory, this creates a situation where this will only be diagnosed as the cause of reproductive loss if certain criteria are met. Those criteria involve nearly a pure culture of the organism. 2, inflammatory lesions have to be seen associated with a pure culture of this bacterial organism. And then 3, there has to be no other more likely cause found associated with that bovine abortion. So again, this creates a threshold where just because you identify Histophila somni associated with the aborted fetus, that doesn't mean it's the cause of the abortion. It could just be normal flora associated with that calf. So we do see, in some cases, a placentitis, a fetal septicemia. In bulls, we can see an epididymitis and an orchitis associated with these inflammatory lesions. It can be treated with antibiotics. There is control available through vaccination. I have been involved with some herds where diagnosis of pure culture of Histophila somni followed by antibiotic treatment and appropriate vaccination caused a very significant increase in the conception rates, the pregnancy rates, and the birth rates of calves. So it's something that should be considered, but we have to understand the challenges that go along with differentiating this from normal flora versus the situation of actually the identification of a pathogen, a disease-causing agent in these animals. Next, we have an agent that has been eradicated in much of Australia, Canada, New Zealand, Western Europe, and the United States. That's Brucella abortus. This zoonotic small gram-negative coccobacilli is actually an intracellular pathogen. It is reportable. It is controlled through regulatory eradication procedures in much of the world. It's transmitted orally. Interestingly, it replicates preferentially in the placenta of cattle. There's a certain sugar that is in the placental tissues that causes this gram-negative organisms to replicate just in a logarithmic manner, a tremendous rapid growth, causing placentitis, causing abortion of these calves late in gestation. This organism is shed in uterine discharges from 3 weeks before to 3 weeks after abortion. One of the reasons that's important, again, is because this is a human pathogen as well as a bovine pathogen. So we have to be concerned about veterinarian health, producer health, when we have this gram-negative organism that is amplified to a huge concentration associated with the bovine placenta being shed out into the environment. Abortions in these situations occur in the last half of gestation. Again, much of the world has a systematic eradication program and has eradicated this organism, but it's often helpful for us not to forget the potential for this agent to be identified in areas that has previously been eradicated. You see in the United States, we have a problem around Yellowstone Park associated with buffalo. We don't control this bacterial infection in buffalo. At times, the organism will be transmitted from the buffalo into herds around Yellowstone National Park in the United States. But we do see control based on testing of animals using serology to see if they're seropositive, if they have antibodies for the organism, culling infected animals, and vaccinating susceptible animals. The modified live vaccine may cause a zoonotic exposure, so we have to be careful understanding that that's a modified live vaccine, modified live bacterial vaccine administered to animals actually can, under certain unique circumstances, result in transmission of that zoonotic agent to people. So there has to be some consideration for safety surrounding the use of that vaccine. Vaccination of pregnant heifers can cause problems. So again, that has to be carefully monitored in the eradication program that we're concerned about. Let's move on to another bacterial agent that's zoonotic and is really a problem for us as we deal with different situations, and that is Leptospira. There are different species of Leptospira, but what we're seeing here is that Leptospira is a challenging situation. If we consider, in essence, two different situations, you'll see on different halves of this slide. On the left half, we see a discussion of what we can call host-adapted lepto. Host-adapted leptospiral organisms, in essence, cause very little disease and survive very well in that host animal. Here we're talking about Harjo and Harjo-progitno species. They can cause abortion, have very low pathogenicity, can cause some degree of infertility, but the abortion rates are very, very low, can be hard to actually detect in a population of cattle. There's also an association with early embryonic death, but we don't see any other clinical signs. There's no other signs of illness of that cow. It can result in an autolyzed fetus. If we consider the right half of the slide, though, we see a very different picture with species of lepto that don't, in essence, grow well or don't cause this endemic disease. They cause very significant disease when we consider these serovars that are maintained in other animals, such as Pomona, often found in pigs. When it infects cattle, it's a sporadic disease. It does not commonly occur, but it's associated with abortion storms. So rather than seeing a less than 10% rate of abortion, we're going to see a greater than 50% abortion in this specific cattle herd if we see Leptopomona causing that infection. So here we see clinical signs not only of abortion, but also of systemic disease of that cow. So we can see the hepatorenal disease associated with liver problems, kidney problems. We can see photosensitization. We can see a hemolytic anemia in these animals. So a very significant, severe systemic disease will be identified in association with these abortion storms as we consider these serovars of lepto that aren't endemic in cattle populations. So then we get into the question of how do we control that? Understand this is a zoonotic organism. We would desire to see control. Unfortunately, in the United States, when we consider reproductive loss in animals, quite a bit of work was done with a vaccine. Very nice study, looked at using 2 doses of a monovalent vaccine against Leptospira board-petersoni serovar Harjo strain Harjo bovis. So this was the specific endemic strain that we talked about that we considered to be causing low levels of reproductive loss in cattle. Tremendous study involving 1,894 Holstein cows and heifers from Central California dairies. When they did this randomized controlled trial, they saw that this vaccine was not effective in improving reproductive efficiency or in decreasing urine shedding of lepto. So in essence, that caused us to say this very specific vaccine focused on lepto control actually was not decreasing reproductive loss, and it was not decreasing the urine shedding of this organism into the environment. However, we need to be careful. Producers will often take that message and say there's no need to be concerned or vaccinate for any serovars of lepto, and that's certainly not the case as we consider Pomona, Harjo, Grippotyphosa, Canicola. We need to think about Pomona, Grippotyphosa, and Canicola as these serovars that are not endemic to cattle but can cause disease. So therefore you see, based on reproductive loss in specific herds, vaccination against these serovars certainly could be recommended so that we can avoid abortion storms or a high percentage of abortions that are occurring sporadically over a large number of years. If we jump to the next organism, this one's an interesting coccidian parasite. It's estimated to, in the U.S. dairy industry, to cause $546 million of losses, the beef industry $111 million of losses. It occurs in all countries. I know of no country that has a Neospora caninum eradication plan. Understand that we see abortions between 4 months of gestation and birth. We can see stillbirths, premature calves, and calves that are showing a neurologic impairment associated with this infection that occurs in utero of these animals. Transmission occurs to cattle by ingestion of oocysts that are shed in the feces of infected dogs. These can be wild canids, such as coyotes, wolves, others, or they can be domestic dogs. But we see that ingestion of the oocyst from the feces of these dogs, as that contaminates the feedstuff for cattle, can be associated with the transmission of Neospora caninum. We can also see a pretty consistent transmission from an infected cow to the fetus in utero. So this vertical transmission that occurs can result in problems as we consider the situation. Years ago in the United States, we had a vaccine. That vaccine was shown not to be effective. So currently in the world, there's not an effective vaccine to control Neospora caninum infection in cattle and the resulting reproductive loss. We do see that it's important as an attempt to control this disease is to protect the contamination of feedstuffs from canine feces that might contain the oocyst that would cause the problem. Next, we can look at a pear-shaped flagellated protozoum, Trichomonas fetus. Trichomoniasis can cause significant reproductive loss, often in delayed conception rates, often in a few late-term abortions, but more commonly we're concerned about this infertility early on associated with inflammation in the female reproductive tract because of this protozoal agent. Understand that we can see some pyometra, we can see some fetuses that are aborted because of this, but again, the greater problem is this early embryonic death, infertility, delayed conception rate. When we look at the clinical signs, we'll see a high percentage of non-pregnant cows, we'll see a delayed conception, early abortion, repeat breeding, occasional late-term abortions, pyometra in a small number of cows. The reason I bring up pyometra is because it's not commonly seen, but if you see very many pyometras occurring after breeding, certainly in a beef herd, Trichomonas fetus needs to be very high on your differential list and needs to be a significant concern in that situation. The economic impact of this organism is loss of a calf crop, either because of the fact that you don't see pregnancies occurring or because those pregnancies occur later. Therefore, the calves, if sold at the common time, are going to be lower in weaning weight and not as profitable for the producer in that situation. There's also the cost of culling infected cows and replacing infected cows and bulls when we talk about trick. Some of the challenges is the the confidence in diagnosing the absence of infection in an animal. In essence, when we look at bulls with Trichomonas fetus, we don't see clinical signs of disease, but what we do see is if you simply have a single sample, and regardless if you're doing PCR on that sample or doing culture of the organism on that sample, if you get a negative result, the certainty with which you can say that that bull is negative is a real problem. So the confidence in the validity of a single negative test on a bull is certainly challenging. We have to look at the risk factors within a herd. If they're using natural breeding versus artificial insemination in cows, that will increase the likelihood of trick being a problem in the herd. If they're a really large herd, if they have 550 or more cows compared to having 100 to 499 cows, you can see on the slide, there's a very different incidence of Trichomonas fetus in the United States that we can see associated with these situations, especially when we have operations that are running what can be called multi-sire units, where you're sending out a large number of bulls to breed a large number of cows, all in one pen, all in one contained pasture. We can see significant problems with trick being passed year to year through this group of bulls as they all breed the cows. Control in this situation, biosecurity, testing, again, you need accurate testing. This question about whether or not we can rely on a single negative test, whether we're talking about PCR or culture, comes back into play. Culling of infected animals. As you cull infected animals, you're going to have a situation where you can, in essence, have a herd that's free of Trichomonas fetus, and then with appropriate testing and control measures, provide assurance that you don't allow that organism to be reintroduced into the herd. In many situations in the U.S., we will have herds that are free of trick. We will have counties, even states that have put testing into play such that there's freedom from Trichomonas fetus and the losses that we've discussed. There is a vaccine available, and it should be understood clearly that this vaccine can certainly improve reproductive performance in infected herds. As you see here on the slide, 2 doses of a killed Trichomonas fetus vaccine administered 14 days apart, with a second dose administered 60 days prior to a very rigorous controlled challenge, inoculation of these individual heifers with this organism and subsequent breeding, increased the conception rates from 70% to 95%, and also increased the calving rate such that we saw a 50% calf crop in the vaccinated group, a 20% calf crop in the non-vaccinated group. So the vaccine is certainly effective, but at the same time, the vaccine is not the answer to controlling this problem, because a producer would be much more profitable to not have the organism introduced into the herd than they would be to vaccinate cows to prevent this loss that is occurring. So while the vaccine is effective, you clearly see that the vaccine really only provides a portion of the control that is needed. The greater emphasis should be placed on not introducing this organism into the herd. Now let's talk a little bit about our viral pathogens. We're going to talk about 2 viral pathogens that can cause reproductive loss in cattle. We see the 2 most important viral pathogens. One is bovine herpes virus 1. This is a DNA virus. It's transmitted by nasal secretions, oral secretions, semen. As so many herpes viruses do, this virus establishes latency so that it can be associated with long-term non-proliferative infection of cells, but following stress of that animal, we will see recrudescence of this herpes virus. We will see intra-axonal transport of the herpes virus back to the site of entry, whether it's a respiratory lesion or a reproductive lesion, and we can see recrudescence. Latently infected cows will shed virus either through nasal secretions or through vaginal secretions in these situations. Bovine herpes virus 1, you see it can range from a subclinical infection associated with fever. It can cause infertility. It can cause endometritis. It can cause decreased conception rates. It can cause infectious pustular vulvovaginitis in the cow. It can cause infectious balanoposthitis in the bull. We can see ocular lesions, conjunctivitis, significant respiratory disease. And then depending on the animal and depending on the stress, it can go into a situation where we see the latent infection. And when I say we see the latent infection, what I really mean there is we don't see anything because that animal is latently infected. When they're not stressed, we're not seeing any disease, any lesions associated with that animal. But then during a time of stress, we can see some recrudescence. So in essence, this is a situation that there needs to be control. We have seen eradication programs in Europe be very effective with this. Unfortunately, in the United States, we still deal with bovine herpes virus 1 as a significant reproductive pathogen and a very significant respiratory pathogen in groups of calves. So the focus can be to work toward eradication has been done in many parts of the country, in parts of the world. Unfortunately, in the United States, we're not currently there. We do have bovine herpes virus 1 that is very ubiquitous throughout many cattle populations in the United States. So the control then rests on modified live vaccines and killed vaccines. We can see that with modified live vaccines, the immunity is very quick to occur, occurring anywhere from 48 to 72 hours after administration of the single dose of a modified live vaccine to animals. The duration of immunity is very long. There's this concern about reversion to virulence that we don't see that we commonly are concerned about, but we do know very clearly based on studies in the United States that the modified live IBR vaccines can be associated with abortion if administered to pregnant cows. Now in the United States, you can only administer modified live IBR vaccines to pregnant cows if they have previously received the same vaccine prior to breeding. But even then, the research would indicate to us that we can see somewhere in the neighborhood of 1 out of 200 abortions associated with administration of that vaccine to pregnant cows. So there's some risk associated with a modified live vaccine for IBR if that is to be administered to a pregnant cow, even according to label claims in the United States. The killed vaccine, on the other hand, certainly can provide a great benefit. There's intramuscular or subcutaneous administration of that vaccine. There's immunity in 7 to 10 days after the second vaccination. So again, with the killed product, you have to give 2 doses, normally 3 weeks apart. There's a shorter duration of immunity. It does not replicate in the vaccinated animals, and therefore it's safe in pregnant cows. So we have these 2 different vaccines that can be used for the control in the United States. And in essence, it is very clearly indicated that we need to have some vaccinal protection of cows for this virus in the United States. And then we have really the topic of conversation that you will hear more discussion on, and that is bovine viral diarrhea virus. Now again, remember where we started in this presentation. We started with the discussion of the fact that a reproductive loss, an aborted bovine fetus, is often the most dramatic situation that a producer runs into so that they can say, we need to do something about reproductive loss in this herd. But understand BVD, while it can cause abortions, it can cause these late-term, very dramatic abortions, BVD causes much more significant infertility, causes much more significant reproductive loss early on, this early embryonic death, than we see late. BVD, a unique pathogen. You've heard some about it before. Understand that we can see a variety of situations, some being very subclinical to some being associated with acute death. It's the fetal infections that can be most dramatic. And of course, a situation where if we have development of the persistently infected calf, this calf that's infected with a non-cytopathic strain of BVD before approximately 125 days of gestation will result in an animal that sheds this virus for its entire life. And that shed virus will cause tremendous problems in all animals that it contacts that are naive to the virus. So in essence, in the United States, when we consider BVD, we understand it can cause some of these late-term abortions, but the more important part is the infertility, the early embryonic death, the reproductive loss that is often unseen, not as dramatic as these late-term bovine abortions. And understand that when we look at control of BVD in the United States, the question becomes, Is this herd exhibiting signs of BVD? What I mean by that is not are they exhibiting these late-term abortions, but are they demonstrating lower conception rates, lower pregnancy rates than would be desired? And if so, you have to begin to ask some of the other questions. Should you invest in the surveillance to detect these persistently infected animals? A veterinarian cannot identify these persistently infected animals just by looking at them. There has to be a test for the virus to provide any assurance of whether or not an animal is persistently infected with BVD or not. Then can you control this potential for introduction of persistently infected animals into your herd? Can you create biosecurity? Can you ensure that infected animals are not brought into the herd to expose other animals within the herd? And then after you look at detection of persistently infected animals and biosecurity to make sure you don't bring new persistently infected animals into the herd, then we need to look at vaccination as well so that we can provide an assurance that animals are not going to be as susceptible if they do encounter this disease-causing agent in other situations. So with that, I appreciate your time. I hope you walk away from this presentation with multiple disease-causing agents in your mind and understanding what can be done to diagnose and to control those reproductive pathogens in cattle.